Hello everybody, my name is Taylor Greene. I'm one of the audiologists here at Audiology Associates.
My name is Rhys, Barber. I'm the other audiologist here at Audiology Associates.
So we've got two patients?
Two patients,
Two patients in this compilation. Mine is the first one you see in here. Oh my goodness.
That is dry skin, isn't it? Look at that.
It is dry, but it is completely taken up the entire shape of the ear canal. It's basically just a cast of this patient's ear canal.
Nice.
It's really satisfying once we get it away, but just bear with us because it is a really tricky removal. With this dry skin, that's basically what we're trying to peel off the eardrum. Off the ear canal, not the eardrum. When it's very, very dry like this, it really, really holds on. That's obviously what I tend to find anyway. I'm not sure you find the same thing as well.
I do. I concur.
We're going to get a little bits away, but it's once we take the bulk of the sort of, it's dry wax in the center, which is basically covered by all this dry skin. So that's what I'm trying to do here now, is just take away that wax that's in the middle. I'm getting everything mixed up in this one so far.
You can see that ripple.
Yeah.
Once this tube comes out, look at the roof of the canal. You can see that kind of rippled effect. And that is classic. I'm not telling you, but I know you know this.
No.
I'm telling you.
No,
But it's classic skin running down over the top of that eardrum there, isn't it?
It's really difficult. Like, patients been struggling with the hair, and I said, I'm not surprised, to be completely honest with you. Even if this was just the layer of skin, what you obviously tend to find, if it's like,
that's gonna be a peel. That is. I'm in for this one, Taylor Greene. I'm down for this. You carry on.
Yeah, if it's like this and it's going right over the front of the eardrum, that's just going to affect the flexibility of the eardrum. So I'm going to just slowly work my way around this cast, just to try and peel all the edges away first. And I think what I'm thinking then, straight after that, if I can get all the sides loosened up, pop a little bit of oil in, that should get underneath, and we should be able to remove this a lot easier. But they are an absolute nightmare to do. I find these quite tricky myself. I mean, I can do them, but they generally are quite difficult. Now you can see the whole thing is moving in little patches. You can see the whole thing is trying to budge. There we are. That's the roof of the ear canal peeled away there now.
I feel like I need snacks.
Yeah. Don't eat now when you're watching this.
I think that the thickness of that skin, I think that's going to be an immense peel when that comes off.
No spoilers.
No,
No spoilers.
that's it. But you can just tell by the way that skin looks, that is going to peel really, really. That is going to be a satisfying, thick skin peel, that one.
Trying to gently get this bottom layer away. Not gonna. The bottom layer here is quite. It actually feels tougher than the rest of it.
It almost looks slightly thinner, so it almost looks like it's hardened up a little bit. Whereas the rest, it looks like it's got that thickness. So there's a bit more give to it.
So we're on the right-hand side here now, trying to. Yeah, I know. This little flap of it that's kind of coming down the top half here. This is just getting in our way of the wall, basically the ear canal wall. So this is the part I'm trying to get to now.
It's not. Yeah, it's just not really kind of coming away.
No.
You'd really want that nice kind of peel across the bottom there, wouldn't you? But that really hard bit there. That's solid, isn't it?
It's a pretty tough one. Literally, like, touching up on like several different pieces of it to try and see if I can get it shifted. Like, everything is starting to peel away except this little bit in the corner. Yeah.
And that's where you can get a little bit of almost like canal remodeling sometimes, can't you? Where you get that kind of pressure on the side.
Yeah. Should get the...
Sorry guys, so we're locked out. Oh, we're right mid voiceover, so we had to go deal with that. We're coming back now.
So carrying on from where we left off. So bit of oil has gone in here now. Now you can see I am trying to move this side to side because that's going to start working that oil down these little gaps. It's got in quite well, the oil. It's managed to get itself right the way around this plug.
That's a nice peel. How it's flexing that bit of skin there as well.
It is layer upon layer. It's like an onion.
Yeah.
but a really satisfying one.
Yeah. That's not.
Oh, come on. It's really, it doesn't look like it on the video, but we can feel the kind of resistance as we're trying to, you know, as we're trying to pull these away. I've had to stick with the fine end here because of how thin these pieces are. I know we've mentioned it a lot, but you'll generally tend to find this might whistle quite a lot with the standard size.
If you could guarantee you get that standard size, then you just plant it right in the middle without getting any of those edges in,
then we'd be fine.
You'd be fine. Oh, that is a lovely, and that is the eardrum. So the eardrum's already peeled then, by the looks of it.
Yeah, it's come away from the eardrum, so it's just the sides now. We're waiting to come away.
Around the corner of that suction too, but it's not going to work, is it? But
you can try.
I can have a go.
Walk on the back.
It's like one of them dogs you see when the squirrels go off the screen. They're going to look at where it's gone.
Probably could have gone in with a forceps there. Do I do that?
Like as if you did this yourself.
I know, yeah, exactly. Still have to work really careful, or still have to go really, really gentle, because it is going to break little tiny bits. I've got to get a bigger. I think I get a deeper grip. I think I can get more down the forceps in the jaws.
Yeah.
Yeah, this little bit here now. Just get a little bit deeper.
Yeah.
There it is. That's it.
I'll do it. Oh, go on. Go on.
Here it comes.
Go on. Look at that. Wow.
Oh, literally just an entire cast of the ear canal. Look how clean that's come away.
Blinking heck.
It's literally just a sleeve.
Yeah.
It's like a sleeping plug.
It was, look at that.
Bit of a zoom in for you as well. Yeah.
Half. It's moving around so much I can't tell. Half an inch. I'm going to go with half an inch on that one.
A centimetre and a half, I think, roughly on that one. So
see, for the members video yesterday, we said to everyone, there's good ones coming up this week. We'll say it to you guys, well, there are some really, really good wax with lots of really bad skin ones. There's a lovely eardrum peel coming up. There's some good ones coming up this week, guys, so make sure you keep an eye out for those. So this is actually my patient now. It's quite tame in comparison to Taylor's, really. But basically what we've got here is a very kind of thick skin layer, a bit like Taylor's, and we've got skin and wax in this one as well. So I'm just going to get this plug out. Let's give this a little bit of a wiggle. There we go. That little round ball of wax there. And what you'll see, if you look just to the right as you go into the canal here, I think the patient has had a little bit of canal remodeling at some point, I think, only mildly, but you can see that very kind of deep section there just inside the ear canal. But then other ear now, we've got a very thin sort of front end to the wax there. Yeah, it's a hard one to kind of spot what's going on.
I couldn't quite work that one out then. I was like, is that sideways? Or?
This is what I mean about the canal. He had a very, very kind of pronounced, almost like a recess. I think it's the posterior. Is it? No, this anterior. So you had a very pronounced kind of, as you go into the entrance of the canal, just this dip on the one side. I think that's where a lot of this dry skin, dry wax was all kind of hanging around in that area, just not migrating out particularly well. Cool. Yeah, look at that. Start to break those little bits off. There we go.
Yeah, it's always like really unfortunate when you've got quite a narrow ear canal, because it's just, well, and you can't do much with wax anyway, because your ears just produce it over time. But when it's really narrow, it just is a very low chance of that coming out by itself, and you'll more than likely need regular treatment. Yep.
It's coming away nicely now, though. We're getting a little bit of a wiggle on. Here we go. It's going. It's not quite getting there though. I had a few of these recently. I'm always in two minds at this point. Do you just switch up, just use a manual tool for that last pull, or do you try and do it with the suction?
There's not much room there. Oh, there we are. I was going to say there's not much room there, is there?
No. And there was that kind of layer of dry skin around that outside edge.
Yeah.
Look at this, coming away.
Cool. Oh yeah, I can see
how pronounced that is, and that's the kind of posterior section. So these are the bits we actually removed on this patient, so it was, bang on an inch, I'm going to go with that. 3 centimetres. Well guys, thank you very much for watching our video again today. Make sure you smash that subscribe, follow button, hit the bell notification if you're watching this on YouTube. That way then you'll get to see the really good ones that are coming up this week. But as always guys, in the meantime, take care of yourselves. Take care of your ears. And take care of one another, and myself and lovely Mr. Taylor Greene. We'll see you again soon. Bye everybody. Bye-bye.